Hello, namaste. This is a video looking at the anatomy of the pelvis, the pelvic floor, and the hips. We have a learning objective here of asana, exploring ways to teach alignment of the hips and pelvis. So one of my favorite areas to talk about, quite passionate about the pelvis, the hips, in particular with yoga, how we can safely teach postures to not cause further strain or injury to this region. Also, my particular area of specialty is women's health, so looking at the pelvis and how different asana can help assist women with a variety of women's health issues. So, here we have the pelvis. Obviously the spine attaches to the pelvis through the L5 vertebrae, L5 disc attaching to S1 of the sacrum. But for this, I'll take the spine away and we'll focus on the pelvis. So, if you haven't seen this before, this is the pelvis. Such a beautiful part of the body in its structure. Just to first look at the skeletal anatomy here. So this is the front. You have the ilium, the big bone that is on either side, connected at the front by a fibrocartilage disc, which is fairly fixed, not completely fused, but fairly fixed. To the back, you see the ilium on either side. Again, this big bone on either side, attaching into the sacrum. The sacrum, this triangular shaped bone, historically called os sacrum, the sacred bone. So a triangular shaped bone connecting in via the sacroiliac joint, or SIJ, sacroiliac joints on either side. Again, a very stable joint, not fused like it used to be. It used to be thought that there's no movement here. There is definitely movement that occurs at the sacroiliac joint. Not a lot, but there is movement there. At the bottom of the sacrum is the coccyx, this very sharp tail, remnant of our tail. The sit bones, sometimes you hear people talk about the sit bones. So these are what's called the ischial tuberosities, which a tuberosity is a bony protuberance. So the bony protuberance of the ischium is the ischial tuberosity, and those are your sit bones. Like I say, from sacrum S1 is the disc area where the L5 S1 disc would sit, and then the L5 vertebrae body, which links into the spine. So you can see these little yellow things coming off represent the sacral nerves out of what's called the sacral foramen. Foramen is a hole. So the sacral foramen houses the sacral nerves that come off, innervating the sacroiliac joint, lowering down into that kind of horsetail bundle of nerves called the cauda equina, the tail of the horse. And have a look at this. Look at Google, cauda equina, and you'll see this beautiful just this lovely tail where the nerve endings come down and kind of drape down the base of the spine, base of the sacrum. So to the front again, you can see the sacroiliac joint lines on either side. You can see the pubic symphysis. That's what this fibrocartilage kind of disc joining the two sides of the ilium. Sometimes we call it the pubic bone. It's not actually a bone, but it is a fibrocartilage disc pubic symphysis. And there is movement there, particularly childbirth. So that's where you can see quite a lot of movement, and even an instability within the pubic symphysis, causing quite a painful pain syndrome at the very front pubic bone area. So this incredibly stable yet mobile area of the body, housing pelvic organs here, uterus, the reproductive organs, digestive organs, the top of that. Underneath it is the pelvic floor group of muscles, a sort of hammock-like group of muscles that sit at the base of the pelvis, from tailbone to the pubic bone. So sitting underneath. To the side, we have our hip joint. So there's the socket of the ball and socket joint of the hip. So the top of the femur is a ball, and called the femoral head, and that goes into the acetabulum here, the socket. This is lined with a very thick cartilage here, and obviously cartilage on the top of the femoral head, held together with very strong capsule and strong ligaments, forming one of the more stable joints of the body for weight bearing. So yes, we need stability. We need stability here. We transfer all the energy from the spine down through the sacrum, and the iliums provide that bony loading to then transfer the loading through the hips on either side. Conversely, you could say that could happen from the feet up. So if you think the contact of the foot up through the tibia, fibula, up through the femur, driving into the hip joints on either side, which then the triangular bone at the back, the sacrum, transfers that energy to the midline from the iliums also, and then up the spine. It's an incredibly beautiful architecture that provides us with our stability of the pelvis, connecting the lower limb to the spine. Also providing this incredible outlet for childbirth for women. As you could imagine, the movement of the sacroiliac joints during pregnancy and obviously during birth is vast to accommodate the head of the baby. The movement of the pelvic floor to accommodate the birthing process. Quite remarkable what this region of the body goes through during birth and pregnancy. Also cyclically, due to the varying hormones during the monthly cycle, you do get slight changes in the sacroiliac joint ligaments due to levels of estrogen. So even not pregnant, a woman would experience differences in ligament, not strength, but more laxity due to estrogen, and a slight movement at the sacroiliac joint. So for any of those out there that feel a little bit of an achy back, low back, maybe premenstrually, that is due to the ligaments changing slightly due to the level of estrogen. Also menopause, perimenopause, menopause. So the changes in our hormones affect this region quite considerably. Also affect the pelvic floor. So the decrease of estrogen, you can get a not laxity, but you can get a weakness more noticeably during menopause, a weakness of the pelvic floor. So you can see we're kind of setting up here for potential areas of weakness or instability within the pelvis, particularly for women, but definitely for men too. Men experience maybe hip degeneration, as women do too. There might be also a weakness into the pelvic floor for them as they age, and an involvement of the prostate with changes of the testosterone as men age also. So it's not just confined to women, obviously. Also, if there's trauma, if there's blunt trauma, as in a fall down on your hip. Maybe some of you experience a painful fall down. I have before. Painful fall down onto your coccyx. Maybe an injury to your lumbar spine, which then affects, if your lumbar spine isn't moving in a kind of biomechanically safe way, then alterations of movement into your pelvis is what you could see. Changes in leg length also, if you have a slightly longer leg, one side or the other. If there's injuries into the knee, the foot, the ankle, etc., etc. So the leg bone's connected to the pelvis, obviously, and the pelvis connected to the spine, so all interconnected. But I just want you to really get that visual. It's a beautiful, what I call the pelvic bowl. It's a beautiful bowl-like shape. And this pelvic inlet, it's called the pelvic inlet, or the shape of the whole of the pelvis, varies with race. They've noticed different races have different shapes here. Varies with male female, obviously. The female pelvis is wider, so the iliums are kind of more fan shaped outwards. The male pelvis is more, so these little points here called the ASIS, anterior superior iliac spine. They're more kind of linear and more forward in the male pelvis. And the shape of your ilium, or the orientation of this ASIS point here, whether it's more forward facing or more fan shaped, will also affect the position of your hip. So they have actually studied that in Asian and Indo-Asian pelvises, the shape of the acetabulum here is more slightly out. So the iliums are slightly more fan-shaped outwards. And that would maybe account for an increase of range of motion. So as yoga comes from East, these postures that are very open are more accessible, actually, to the Indo-Asian skeleton than the Caucasian skeleton. And I often say this in classes because, it puts into perspective a little bit for the Caucasian pelvis. And maybe some of these postures aren't so accessible for them. So that's genetic variations. There's also habitual variations, as in to do with our culture. So Indo-Asian cultures squat more. Toilets are more squat toilets. Sitting on the floor more, potentially. Not sitting in the chairs so much, the 1990 position of the hips and the knees. You're more sitting on the floor, varying the position of the hips. Is definitely more conducive to having greater hip health, less osteoarthritis, they've studied, and obviously a greater sense of mobility. So sit on the floor more if you can, and encourage your students to sit on the floor a little bit more. not just in yoga postures, but just the act of sitting on the floor and changing positions of the hip, either cross-legged or one leg out or squatted, is actually very beneficial for the hips. So much more we could say about the pelvis, the anatomy. I'll encourage you to look into it further yourself if you are interested. But what I do want to mention is the muscular structure. So here, let's imagine that this scarf is the pelvic floor. So again, a parachute-like or hammock-like shape of muscles, that quite complex group of muscles that are all on different orientation of fibers. Some are more longitudinal, some are more on diagonal, some are more horizontal. So again, look into this, have a look into the pelvic floor anatomy. It's quite fascinating. But if we think of the attachment to the symphysis pubis at the front, forming the base of the pelvis and attaching to the coccyx at the back. So it creates that hammock underneath the pelvis. Obviously, like we said, with age and hormonal changes, the pelvic floor can weaken. Also pregnancy, difficult births, weight can cause excess weight can cause a sort of downward action of the pelvic floor, and possibly even prolapse of the pelvic organs, uterine prolapse, which will weaken also the pelvic floor. Trauma, sexual trauma, constipation, straining, excessive straining, people with respiratory disease, excessive coughing, also put strain on the pelvic floor muscles. So it's pretty remarkable in yoga. We have the bandhas, mula bandha, the root lock, to bring awareness to the pelvic floor and to strengthen, not only strengthen, but to also relax, because that can be an issue. It's not always about strengthening the pelvic floor. Some women and men have an hypertonicity of the pelvic floor, which causes them to have issues with complete voiding when they urinate, sexual pain, difficulty in fully emptying the bladder, etc., etc. So it's not always about more here, it's about achieving that balance of strengthening and relaxing. So that's the pelvic floor underneath. Anteriorly, we look at the abdominals. So we have different layers of the abdominal wall. We have at the deeper layer, the transverse abdominis. So as the name suggests, the fibers run in a transverse direction, as in horizontally. So my fingers are kind of showing the direction of the transverse abdominis muscle. So that would cause a stabilizing force on the front of the iliums here, bringing together the anterior part of the pelvis. So it's the deepest layer, transverse abdominis. And that layer actually comes round and attaches to the fascia, thoracolumbar fascia, and actually then attaches into the very deep, or has connections to the very deep, called multifidus, the very deep vertebral stabilizing muscle. So not the big long muscles of the back, but the intersegmental muscles that go up and down. So transversus abdominis, very important for stability of the pelvis. You could say those are the core muscles. Then we have our obliques. We have the internal and external obliques, and they run on an angle. So the obliques run on an angle downwards, and also the other way. So from center line outwards. So they are either in like a cross diagonal shape, inside to out, or the other way, outside to in, causing a kind of cross-hatching pattern in the abdominal region. So they're your internal and external obliques. They go on an angle, that way and that way. And then you have the rectus abdominis, which is the big, strong, superficial abdominal muscle that runs vertically. So just as the overview again, you have transversus abdominis, which runs horizontally like a belt. You have the obliques that run on a diagonal that way, and also on diagonal the other way. And then you have the rectus abdominals, which run up and down. So quite a remarkable amount of stability provided from the abdominal muscles in the front and the sides. At the back of the pelvis, you have your glutes. So you have glute maximus, which is the most superficial glute muscle, stabilizing the sacroiliac joint, causing the prime movement of the glute maximus to extend the hip back. Deep to that, you have glute medius and glute minimus, and they sort of form, kind of layer into this part of the ilium and cause the hip to externally rotate and stabilize the hip joint. So glute maximus is the largest glute muscle, again causing the hip to extend behind. Glute medius and glute minimus are more for rotation of the hip and also for stability. They're all for stability, but the glute med and minimus are the deeper muscles, so they actually really help stabilize the sacroiliac joint. So anybody out there with an unstable sacroiliac joint, place to really start strengthening is glute medius, glute minimus, glute maximus, pelvic floor, and transversus abdominis. What else do we need to say here? Obviously the fascia, the thoracolumbar fascia or thoracic lumbar fascia, has a massive role to play here. It actually covers from the lat muscle up here, running down, and integrates into the opposite glute. So you get this lovely cross fiber support from one side of the lat over to the other glute via the fascia. And we've talked a little bit about fascia before. So important for the stability of the pelvis. So much more to say. Let's go to the sciatic nerve. If we think of the nerve distribution here, we've got the sacral nerves, the lumbar nerves coming off of each segment, joining into a sciatic nerve, which is a very big, thick nerve that kind of pierces through the piriformis muscle, which is another deep muscle of the ilium over here. Pierces through the piriformis, runs down the back of the leg. The pudendal nerve is a very interesting, important nerve that supplies the pelvic floor, and that can be implicated with damage, pudendal nerve damage through a difficult childbirth or surgeries or trauma. So that's the pudendal nerve. And again, it's not something that you might ever need to come across again, but it's just to give you an awareness of this incredible region of the body. So often in yoga we hear about hip openers, and yeah, I just have a little word of caution as to safety, really safety of these hip openers. For the most part, most people maybe that come to yoga are looking to increase flexibility, and the hips are definitely a region where they can be inflexible. But just be aware of hip opener excess. It's not all about flexibility. It's also about stability. So kind of a rule of thumb is if you're increasing flexibility, there should be enough stability to support that. If not, you tend to set people up for, or set yourself up for a hypermobile joint, whether it's in the hip or in the sacroiliac joint. Maybe you have an instability there already. And for you, it's more about creating stability as opposed to more flexibility. Like everything, there's a balance. But that's just a bit of a word of caution. The other muscle group we should talk about is the psoas, commonly heard about today. And the psoas is a really interesting muscle. Psoas is a very deep muscle, also called the muscle of the soul. So it originates from the lumbar spine. So imagine the lumbar spine here, coming out of the sacrum, attaching to the low lumbar vertebrae on the sides. And it actually, there's two parts, the iliacus and the psoas, so it's iliopsoas. So the muscle kind of originates from the lumbar spine, and the other part of it, the iliacus, sits in this kind of basin of the ilium here. Where you can get in trouble with the psoas is that it becomes hyper vigilant, as in there's a tightness or a increased tone in the psoas due to the nervous system being overfired. So it's a fight and flight muscle. A lot of muscles are, but particularly the psoas is, because it's contracts when our nervous system is in that fight flight side, the sympathetic nervous system, because you basically are giving signals to your body that you're ready to run. So when the psoas, iliopsoas, is engaged, you're basically in a state of fight flight. The body is almost ready to run physically. So, which is great if you actually have a threat, a physical threat. When we're in this prolonged state of fight flight, and there isn't actually a physical threat that we need to run away from, you can see what's going to happen. You're going to get maybe trigger points within the iliopsoas. The iliopsoas maybe could become shortened, which affects the biomechanics of the pelvis. And when we're in this heightened state of our fight-flight nervous system, we all know that feeling of feeling depleted, overstimulated, wired, the mind buzzing, when really there isn't that physical threat to run away from. So I encourage you to look into the iliopsoas further, and we'll certainly look at some yoga poses together that can help lengthen that group of muscles. So that's the anatomy side of things. Let's go into a practical experience of some postures that can help stabilize and focus the awareness at the pelvis and pelvic floor, and go into a experiential practical experience.